Arthritis with Paul Rosen.
Our diets, our Western diets in America are just really, you just don't realize how poor they really are.
What would you say to others who would like to feel better?
Sometimes you need to find the instruction. That's where the testing and everything comes in, because without that knowledge, there's no way I could have got to the point where I'm at today.
Straight talk about health.
And then I start preaching and telling them what I've been doing. And this guy named Paul Rosen has changed my life.
With your host, Paul Rosen.
By the way, the information contained in this program is not approved by the FDA, nor intended to treat, diagnose, or claim to cure any medical condition or disease as defined by Western medicine. However, skilled practitioners of many disciplines have found nutrition response testing to be a highly reliable supportive technology for assessing the health and fitness of the body's functional system.
The reason I stopped at Rite Aid this morning on the way to work, Paul, was that I had a sore throat yesterday. And for me, a sore throat is usually the first sign that I'm about to get a cold. I did not want to come to work this morning with a cold. So I did two things, and you can tell me whether or not I'm on the right track here. Last night, I cranked up the heat at my home and baked myself like a potato all night long.
I wondered why you have that burnish, that nice little burnish.
That always seems to work for me. I do that, and then I stopped at Rite Aid again on the way to the studio and had myself a great big tankard of orange juice, and that also seemed to help my sore throat.
That is just unfortunate.
And so by the time I came to work this morning, I feel great. No sore throat, no cold, certainly. So my solution, A, cook yourself, B, drink OJ, and you're good to go.
And then, of course, the question is, how many others have you helped through colds to get well? And the answer to that question is absolutely zero. So, folks, take that advice with a grain of salt.
So is this all psychosomatic on my part, Paul? Am I just convincing myself that I'm making myself better?
No, I think what it is that you've spent some time actually reflecting on, becoming aware of what helps you and what doesn't. I will tell you that utilizing orange juice or any other type of fruit juice has more downside to it than upside. And anybody who says it,
I'm guessing the downside is the sugar content.
Indeed, and
right?
The funny thing is while we're on the topic, because it does relate to arthritis, bursitis, and tendonitis, and that is that people have been led to believe fructose, which is the sugar in fruit, somehow healthier or healthier than just plain cane sugar or other types of sweeteners. And this is unfortunate because it's just a blatant lie. It isn't true. In fact, fructose is harder on your liver even than just cane sugar. But cane sugar is 50% fructose and 50% glucose. So it's this whole idea that utilizing fruit to obtain vitamin C is just a misunderstanding with respect to what's been pumped out there via the marketing power of everything.
Okay, I need to rethink that whole procedure then. Also, Paul, when I decide to begin my professional wrestling career, my name is going to be Cane Sugar with maybe a Bayou theme.
Ooh.
There you go. That's what I'm thinking about. So when this radio thing all wraps up, as it may someday, my professional wrestling name will be Cane Sugar.
And I'm sure the food that you will utilize before each and every event is jambalaya, I imagine.
Oh, probably.
Okay.
And I will have a good time with all that. It will be
Which,
lucrative.
by the way, is quite tasty. But,
so how does this segue into arthritis, bursitis, tendonitis? How does my use of, maybe mistaken use, of orange juice as a source of vitamin C relate to that?
Well, other than rheumatic arthritis, which is, I may or may not get into that topic. I probably will, but let's set that aside because that's different. But arthritis, bursitis, and tendonitis are generally, especially if they're chronic. Now, that is not true if you have an injury, and shortly after that injury, you have pain in a joint. You have some inflammation. That's what itis means at the end of any, body part. Arthritis refers to joints. Bursitis refers to the pad that is underneath the tendons. that extend from the muscle and wrap around a joint. So it's like a pad or a cushion.
Okay.
And then the tendons, of course, and the itis refers to inflammation.
So let me ask you this, Paul. Are these ailments most common in older folks, or can they strike us at any point in our lives?
Any point in your lives.
And I also understand that many athletes deal with tendonitis, for example. I assume that's because they're putting extra strain on their body parts as they go about doing their jobs.
Well, that may or may not be true. I'm certain that it could be an aggravator. And then, of course, if you aren't waiting long enough between your the interesting thing about exercise is the positive benefits occur in the periods between exertion. So, in other words, if you do a workout, right, the benefits that you receive from it accrue in your resting phase, not in your workout phase.
That's really interesting.
Yeah. So most athletes or people who are exercising in general really overexercise. They overexercise, and they don't allow the full potential of the benefits to set in to accrue for themselves.
Do you think maybe more savvy athletes are more aware of that in their training regimens? They know that rest is every bit as important as the exercise itself.
Well, you would hope that was true, and I think it is becoming more true. For example, carb loading, which used to be the fad for track athletes and swimmers and whatnot, is definitely going by the wayside. So, yeah, there's a lot that's been learned. And I think more and more athletes, certainly professional athletes now, and you see this, are really taking what they eat seriously.
I think that's very true. And a guy, you may or may not consider him a professional athlete, but Lou Ferrigno, the guy who used to play the Hulk on television, he was a professional competitive bodybuilder. Now, we can have another debate some other time about whether or not bodybuilding is really a sport. But he made the point once in an interview that his rest and certainly his diet were critical components of his training. In other words, he says if you're a professional bodybuilder, you do it 24/7, and 8 hours every night is your rest, and that's a critical part of making yourself into the best possible athlete you can be.
Jack LaLanne
would have said the same thing.
Oh yeah,
but did he ever play the Hulk?
I don't know.
No, he did not.
Maybe in a miniature.
However, at the age of 60, Jack LaLanne did tow a barge down a river, so that's pretty impressive all by itself.
No, anybody nowadays who's serious about maintaining performance and and their body understands that what they put in their mouth actually really matters. It's a wake up period of time.
And again, to your point and to our specific topic, your rest is every bit as important as the exercise you do to make yourself healthy.
Arthritis, again, aside from rheumatic arthritis, you've got osteoarthritis, which is the most common condition, chronic, joint degeneration condition that people experience. This is a condition that people literally eat themselves into.
How do you mean?
Well, what I mean is they eat themselves into it.
Okay.
Via their diet,
via their improper
they
intake.
eat.
Okay.
Royal Lee used to say people basically dig their graves one bite at a time. In this particular case, you implemented the degenerative process, the degenerative pattern, one bite at a time. Yes, you did it, right? And so that means if the condition hasn't gone too far, then you can undo it. And what is too far? Well, that really depends on each individual. I mean, I've had people who have had, X-rays done or MRIs done to show that they don't have any cartilage between a joint anymore, and then they're told that's why they have the pain. And then we work together. We design a nutritional healing program, and the pain disappears. Well, what that taught me was that not all and not every single person who has bone to bone, right? That's not necessarily the cause of the pain. And so, before a person actually goes about getting surgery, I mean, oh my gosh, the level of surgery, the amount of surgery that's done to replace knees and hips these days it's just a surgeon mill.
Yeah, it is. And we also have many high-profile people having hip replacements. Most recently, Mark Cuban, the owner of the Dallas Mavericks and a billionaire, had hip replacement surgery.
I mean, I get it. When you're in pain, man, you want to be out of pain, and you're willing to do just about anything.
Again, we go back to athletes, too. If you remember, Bo Jackson, the great athlete from years gone by, played baseball and football simultaneously at a professional level. He had hip replacement. I'm sure, in fact, that had a lot to do with the pounding his body was taking as part of what he was doing for a living.
Well, he also experienced a major injury, too, before that ever happened. So that does set up injuries. Can set up a process of slow degeneration.
And he would have been a relatively young man when he had that surgery. Mark Cuban, the guy I mentioned a moment ago, he's 59 now, which to me seems relatively young for hip replacement surgery.
It's very young, and the thing is these replacements are they do have a much shorter lifespan than the actual lifespan of the human being.
So Bo Jackson, there you have a guy, again, who's taking a lot of punishment on his body with what he did for a living at that time. But what about a guy like Mark Cuban, who probably leads a very comfortable lifestyle? Would he have problems maybe with his diet or with his lifestyle or maybe with his genetic code?
Are you asking?
Well, I can't ask you to diagnose anybody specifically, but what are some of the things we may do, some of the mistakes we may make that will make it so that we have to have such a dramatic procedure at a relatively young age?
Same old song. You got to stop eating sugar. It's the same old song. You have to stop eating sugar. This is not a moderation thing, right? If you're already suffering from a condition like arthritis, bursitis, and tendonitis, you're not living in a normal body. And therefore, if I said, well, there's no harm in eating, a little fruit now and again, right? That may not apply to you who are experiencing this, inflammatory process, this degenerative process that will at some point end up, needing some kind of extreme intervention like surgery, right? You have to cut the sugars out of your life. This is just the nature of the way in which a body degenerates. And sugar is inflammatory by nature. If you have an already inflammatory condition, why on earth would you pour gasoline on a fire? Why would you do that unless you wanted to see it burn? Maybe there are some folks out there, I don't know. But at the end of the day, you absolutely have to first and foremost get a hold of yourself and make the commitment to yourself that you are going to eliminate sugar from your diet. And then it's a matter of identifying the environmental aggravations or obstructions to healing. Because as I say often, the body is a perpetual healing machine until it either isn't anymore, and then you're dead, or it is prevented from doing the healing. And most arthritis, bursitis, and tendonitis conditions, like the woman that you described at the beginning of the show, who's wearing a brace around her wrist, right? There is some environmental factor or factors that are preventing the body from healing. This is not repetitive motion strain. No.
And I probably shouldn't pick on that woman, and I I don't mean to. She was just wearing that brace as a preventative measure, I assume, or just something that eased her pain a little bit. For all I know, she was taking all kinds of additional steps, healthy ones, to help her ease her arthritis. But she just happened to mention it in the context of that brace.
Well, let's put it this way. It's highly unlikely that she had eliminated sugar from her life yet, because otherwise she wouldn't be wearing the brace. It's not that complicated. Right. Generally speaking, and this is the fascia, either plantar fasciitis or carpal tunnel is absolutely, totally, and completely related to what you put in your mouth, and as a result of that, vitamin B deficiencies. I know this because I've fixed it. So I know it's the same old song, but you got to hear it over and over and over. Ask any one of my patients who came to me from the radio show, who have been listening to me for 6 months, 6 years, or more. Right? I always ask them, well, why did you decide to come now after listening to me for so long? And they always say, I just wasn't ready. And I get that. But the longer you go with an arthritic or bursitic or tendonitis or tendonitic, I don't know if that's a word or not, but
it is now.
It is now. With a condition like that, and you're not addressing the root cause, utilizing some medications, which we'll get into in the next segment of the show, which are extraordinarily risky, then you're just you're living a delusional life, because if you keep doing the same thing, you're going to keep getting the same result.
I can guess the answer to this question, Paul, but are most people who suffer from arthritis or these other conditions, bursitis, tendonitis, taking some kind of medication?
Usually. It starts with over-the-counter medication, like Tylenol or some acetaminophen-based, NSAID.
Mm-hmm.
And they are extremely risky. They put your liver and or your kidneys, depending on which one you're taking, in jeopardy. I mean, thousands and thousands of people every year, need kidney or liver transplants because of extended use of over-the-counter pain meds.
And then I assume there are further dangers from more powerful prescription pain relief medications.
There are, and we're going to talk about those. Steroids, for one, put your entire immune system at risk.
Are steroids commonly prescribed for relief from arthritis and these other conditions?
Yeah, it's anti-inflammatory medications.
However, what we're trying to push here is the fact that there are anti-inflammatory ingredients in some foods. Is that right?
There are. Yeah, there definitely are anti-ingredients in some foods, and you may need some additional help. And I'll talk about some of the non-prescription drug options there. But the main thing is if you're already in pain and you're already experiencing this, if you really want to address it and address it at the root cause, it's very difficult to do it without a professional.
And also to clarify, Paul, you mentioned vitamin B. Is a shortage of that also a contributing factor to arthritis?
Yes. Yeah. But in particular this carpal tunnel and plantar fasciitis in particular.
Okay, so we want to take dietary measures to help us get to a better state if we're suffering from these things. I mentioned some anti-inflammatory kind of foods like nuts and seeds, fruits and vegetables. Are those things enough by themselves, or do we require more dramatic measures?
Well, there might be some more dramatic measures required with respect to pain management, depending on how advanced the condition is.
So how do we manage pain? You are very much against medication in most cases. How can we better make ourselves, not feel so bad every day if we suffer from arthritis, bursitis, tendonitis?
Each person is different, and what will work for one person won't work for another. Let me repeat that. Each person is different, and what will work for one person won't work for another. So there are a number of options. I use something called Boswellia with some people. I use it's not aspirin, but it's a product called Salagesic, which is made from the the birch tree, and so and some others, right? But you want to be eating tons and tons of healthy vegetables, and eat fermented food. What kind of vegetables? Broccoli, cauliflower are good vegetables in themselves. and other natural, raw vegetables like celery and carrots and peppers of all different stripes and natures, and just fresh food.
And that actually acts as a pain reliever as well as a preventative.
Well, it's not like taking an aspirin. This is long term. So it took you decades to develop arthritis, bursitis, and tendonitis if it's a chronic situation. It took you a long time, particularly osteoarthritis. It took you decades to develop it, right? So low dose, long term. Just remember that. Low dose of herbs, for example, right? Even low dose of some supplements to restore your digestive capacity, because it's completely compromised. Your body has the ability to restore and maintain joints unless you have somehow negatively impacted your digestive system and or you haven't been eating foods that contain hyaluronic acid. So bone broth, oh my gosh, you can't get a better food, bone broth, right? And it's simple to make on your own. All you got to do is take a bunch of beef bones, throw them in a pot, throw some water in there with some sea salt and some apple cider vinegar, and cook them at a very, very low royal for 8-10 hours.
This point does relate, Paul. As you know, I'm still single, and I still date on occasion. So I went out with a woman a while ago, and often now at this point in our lives, people have pictures of their children, their adult children. In some cases, they want to share with you, or other things about their lives, grandchildren at this point even. This woman was eager to show me pictures of her bone broth that she prepared.
That's wonderful.
I told her I worked with a guy who was very much an advocate of bone broth, and she showed me what she had prepared. And I don't remember everything in there, but it was much as you've just described. It's not just a liquid, as that phrase bone broth may make you think. She had all kinds of healthy vegetables and stuff in there that made it actually look very good.
Did that freak you out?
It was kind of odd to me that the first thing she thought to show me was her bone broth.
Well, good for her, because, more people should see it. More people should understand the necessity of it. Right? Bone broth is one fad I approve of. And the reason is because it's probably the most restorative food for healing a gut. And anybody who has chronic inflammation in their body, whether it be arthritis, bursitis, or tendonitis, or anything else for that matter, then your gut absolutely for certain needs healing. It is destroyed to some degree. And so that's why getting at the root, right, treating the root cause actually is restoring normal health and function to your gut, while at the same time you manage the pain with some herbs or herbal combinations.
Okay, hold that thought, Paul.
Acupuncture is wonderful for helping with pain.
We're going to the phones with Coco. Coco, thanks for calling this morning. You're on the air with Paul Rosen.
Good morning, Coco.
Hi, Paul. I just caught your show. I've had a lot of health issues lately, so I've been doing a lot of changing in how I'm eating. And I heard you talking about bone broth. And let me tell you, if you have one of those instant pots, it is so easy. I make it once a week. And it's 120 minutes is all it takes.
Yeah. Well, actually, the best bone broth really does take hours to make. It really does.
Well, it's the high pressure instant pot pressure.
Understood.
So,
yeah.
To me, it's easier.
Any way you get it, even if you buy it in the store, I'm up for it.
Yeah. And I've had lots of issues lately. I had half my thyroid out last year, and the difference in the way I'm eating now from the American diet is just amazing.
Yeah, the American diet really sucks, doesn't it?
Oh, let me tell you, I don't do AIP yet. I'm trying to go paleo. I do bone broth and chicken and no no pain pills. And I have arthritis in my back. I had a back surgery. I have bursitis, which is really bothering me, and bursitis and tendonitis in my shoulders.
Well, then you better come and see me, dear.
One more note, you can get a free chapter of Paul Rosen's book, The Missing Piece. Just go to his website, acunatural.com, acunatural.com, and fill out the dialog box that pops up. Rest assured, no information you provide will ever be shared with anyone else. So, what are you waiting for? Get going on your personal road to wellness today.